Hi, everybody. Welcome to another session of Reach, where we try to reach out into our communities and bring professionals in a variety of different areas to the families throughout the state of Florida and even beyond on important topics to those, both children and adults, who live with autism. And so today we're really lucky to have Cassie McGovern with us. Cassie is the Drowning Prevention Program Manager with the Department of Health. And we felt like this was a really important topic to bring to you guys. All year round, drowning is a significant issue within the autism community. People with autism drown at a rate 160 times greater than the general public. And you guys who have little kids, you know, they have a high propensity for wandering, and actually 48% of all children with autism spectrum disorder, their parents report that they wander and elope from safe areas. And because our kids have such a draw to water, the potential for drowning is so significant within our community. And we really feel very passionate about being able to bring you guys information so that hopefully you'll feel a little bit more educated, especially at this time of the year, because a lot of us kind of let our guard down when it gets a little bit cooler outside, and we can't do that. We need to keep our kids safe. We need to make sure that our entire community is educated. So we're really lucky to bring Casey to you guys, and I'm sure you're gonna just get a wealth of information from what she has to offer. Okay, so let me bring Casey in here. Okay, so Casey, thank you so much for coming and speaking with me today.
Thank you so much for having me. I really appreciate it.
So why don't we start with, if you could just tell everybody a little bit about yourself and how you got into all the great things that you do today.
Well, thanks for having me. I really appreciate it. I have been in the drowning prevention world professionally for about 5 years. I've been the drowning prevention program manager at the Florida Department of Health in Broward for 5 years. But before that, I got here, unfortunately, the hard way. I lost my daughter, who was 19 months of age, to a drowning in our backyard pool. I thought I was just like everybody else. I thought that I was doing everything correctly. Um, the incident happened when my husband and I were both at home with our three young girls. And we were a big supporter of floaties and thought that they were swimming. And again, just was really, we weren't really educated on the topic and really didn't think about drowning as a whole. We had a fence around our pool, but unfortunately, that one day it was compromised by the gap being left open. And so she found her way out of the home and into our backyard pool. And she survived for a week. And in that week of time we spent at the hospital, we learned so much about the drowning issue, how it happens, how often it happens, and how many lives are actually taken due to something that's 100% preventable. And so before leaving her in the hospital, we decided to commit our lives to it. We said we got to do all we can. We have to educate as many people as we possibly can to not allow the same thing to happen to them. And so immediately after, I started just sharing our story, sharing kind of like the logistics about it with every mom group around, every parent group around, anywhere I could. Plugged myself into the task force and kind of just learned as much as I could at that point, and grieved and just healed. And a door opened up with the health department, and I thought, you know what? I'll have a much larger platform with this. We'll be able to save so many more lives. And so I went for it. And I haven't looked back since. I'm really, really grateful for the opportunity. And I think that with the initiatives that we've created and the momentum that we're building, I see change occurring, especially with like partnerships with you and a lot of other people throughout the community. I think that we're really, really gaining some traction, and change is slowly but surely going to occur for our state.
Well, and that kind of leads me into the next question. So I think that there's a lot of people out there that don't really think about it and how maybe Florida differentiates from other states
Mm-hmm.
in drowning. So can you speak a little bit to how Florida stands in the statistics, and how most of those drownings occur? Like what precipitates it? What comes right before that leads to a drowning?
Yeah, of course. So Florida leads the nation with drownings that we have. Closely following is usually Texas and Arizona, but year after year, Florida definitely tends to lead the nation with the amount of drownings we have. One of the main reasons is our state is absolutely covered with water, whether it's the pools in the backyards, the lakes in the backyards, the Everglades, the ocean. Water is absolutely everywhere, and our kids are drawn to it on whatever level it may be. They don't understand or really understand the cause and effect, and that what could happen if they were to find themselves outside. And so we lose approximately 80 children under the age of 4 every single year in our state. And that just talks about children, and that also just talks about the drowning fatalities. It doesn't talk on the non-fatals, the close calls, the ones that are going to be impacted for the rest of their life. When we look at that number, it goes up. CDC reports for every 1 death, we have 5 impacted by a non-fatal. And so year after year, as long as we've kind of looked at the data and looked at the statistics, we lose the most children and people in our state than any other state in the country. And so we have a big problem. We have to understand that ours may be a little different than most states. Obviously we don't have pools that we close up and oceans that freeze over or anything else. We have to keep our guard up at all times. And so that's the main thing. A lot of it, over the last 3 years, I wanted to kind of go over, we've lost 244 children in our state alone in the last 3 years, 2016, 17, and 18. And of those 244, 203 of them were under the age of 4. And so I think that shows a lot as far as what age group and where we have to really make sure we're vigilant. Obviously, we have to be vigilant with all kids at all times around the water. But I think that they're the most at risk. They're becoming a little more mobile. They're a little more curious, and they don't understand the cause and effect that water brings.
Yeah. And I want you guys all to just think about that for a minute, because according to the Center for Disease Control in the United States, even though it makes some of us within this community a little frazzled, kids are still being diagnosed on average with autism at the age of 4.5.
Right.
That means that we really have no idea how many of those kids that Casey's just talking about are kids who would have been later diagnosed with autism. Because if you look, you can go on to the DCF website and you look at, really what happened. It gives a little bit of a blurb there. You'll see that a lot of those kids they wandered away from safety.
Right.
And
That's what I was going to share with you is the exact situation as the DCF website will say most of them were able to get out of the home unnoticed or undetected is what they said a lot of the times. And I pulled up some of the information just because you asked at one point kind of the whereabouts of it. And again, they're drawn to water and they don't care what water it is. And so there was 23 in family swimming pools in 2019 alone, 10 in a nearby pond or lake, 8 were in during a pool party or a gathering of some sort. 5 of them were at community pools. 5 of them were bathtub incidences. 4 of them were at vacation homes and 4 at neighbors' pools. And so the point of it is like you said, they might have not been diagnosed, but they're all getting out of the home undetected with one or both parents at home or many people at home in essence. Kids are drawn. So we have to make sure that we're understanding that even if it's a bucket of mop water, they're going to want to splish splash. They're going to want to play in it just because they just love that feeling so much. And if you don't, I'm like, they're just drawn and they don't care what body of water it may be. They just want to get in there and play with it.
Yeah, and as you guys know who are parents of kids with autism, our kids have, in addition to the draw to water, they have an internal sensory desire to experience it in many ways, the way that it shimmers, the way that it feels, the pressure underneath. So we have even added components that attract our kids to it. So Casey, can you talk a little bit about in the rates of the drownings, both fatals and non-fatals? Are there particular times of years that we see a spike, and so that parents aren't, prone to let their guard down at this time of year? Speak to why just because it's cool outside doesn't mean that we shouldn't be concerned.
Yeah, I think that the misnomer or the stigma is that the majority of the drownings happen only in summertime. When we go out and do presentations and around the community, many of the parents or many of our partners come and tell us, oh my gosh, I hear about that all the time during the summer months. Oh, it's always such the summer, it's just so crazy. But in actual, the reality of it is in Florida, it happens year round. But there usually is a lot of non-fatals and fatals that happen in the summertime, usually pool related parties and things like that. But in those off months, the fall and the springtime, when we're not really thinking about the water in any capacity, that's when we see a lot of those that are getting out of the home undetected because we let the barriers down. We open up our homes, we break down those barriers. And so they are able to gain access to the bodies of water a lot easier. And so I think that with the state of Florida, it's a pretty average mix as far as every month of the year, we have a lot of drownings. And we have to make sure that we're keeping our guard up and we're staying extra vigilant because it's not just a summer issue like it is in the north. We have to make sure that every month we're keeping our barriers in place, we're staying vigilant, we're knowing where our children are at all times, we're supervising them when they're in and not around the water. We have to make sure that we're just really, really keeping our guard up because we can't afford the luxury of not doing so in the state of Florida.
You had mentioned before about how water is everywhere. Do we have any kind of statistic that tells us, like, how accessible is water? Like, um, most kids, if they left their home, how long would it possibly take them to get to water? Do we have any
Well,
information
it
on?
says that when the child gets out of the home, let's say if they're able to gain access out of the home, they're noticed within about 5 minutes with one or both parents at home. But because the majority of the homes in the state of Florida have a pool in the backyard, if not a body of water within walking distance, they usually can find a way to water within 2 minutes. And so if a parent doesn't realize, let's say they have another child at home helping them with homework or they're loading the dishwasher, the one child sitting there playing on the iPad, next moment they look over and see the child not looking on the iPad. My first recommendation that I could possibly encourage all parents is check the water first. Make sure that the moment you don't realize, when you realize your child's out of your sight, check the water first. That's the most important piece of it. I also encourage door alarms. What we do at the health department is, I'm going to show you, not that you have to have a brand, but these alarms stick on to the door, whether they open this way or this way with 3M tape. And again, it's $10 for a 2-pack. And this alarm is very loud and it will alert you no matter what you're doing in the home to know that the door was opened. So just in case you are helping Johnny with homework and Sally's sitting there on the iPad, you will know without a doubt that that door opened and you better go run and check it out. And I think that this is the first supervision is the first line of defense. This is the second. So that the moment that door opens, you know that they breached it and you know to go check the water first, no matter what.
When it comes to Florida as a state, what do you think is like our biggest challenge in drowning prevention?
I think that our challenge is just getting, I get this is a tough one as well. I think our challenge is just for people to be educated, to know that it can happen to them, to know that because our state is covered in water, that we have to make sure that we're vigilant at all times. And just because we're not thinking about the water doesn't mean a child isn't. Just because the child decided to get out of the pool doesn't mean one moment later they want to get back in the pool. We have to make sure that we never ever let our guards down. And I think that a lot of us, it's transient. They don't realize that or they don't understand it. And I think knowledge is power. So understanding the hazard, understanding that our state has so many beautiful things to offer, but we also have water surrounding, and it's just claiming so many lives, and it doesn't have to. It doesn't have to. So I think that not thinking it can happen to them, not thinking that the child doesn't want to be around the water, I think that that's the biggest struggle, is just making sure that people understand that drowning is preventable and it doesn't have to continue to happen if you're just slightly educated or take simple steps.
So there we go, right? It kind of rolls into the next one. So some of those steps. So you talked about the alarms on the doors and
It,
the fencing around a pool, but what other
right.
things can a parent do to kind of
Well,
get their kids ready for water?
yeah, of course. I think that the first and foremost is obviously supervision is the key. Supervision in and out of the home. When you're at gatherings, just have your guard up just a little bit more because again, you're preoccupied, you're a little busier. The holidays, everybody's a little bit busier. I think that just supervision and supervision more so when you're near the water, making sure if anyone is in the body of water, that you do not take your eyes off it. You do not be, you're not on your phone, and you're just paying full attention to people in the water. When you're in the home, just know that we're the whereabouts. Know that that children move very quickly and they're very curious. So just in case you are preoccupied and you decide to go take a shower because one's napping or they're playing on the iPad or doing homework, that's when the alarms step in. That's the second line of defense, so that that door, the moment is breached, you'll know what you have. You have it. The 4-foot fence around any body of water, again, is just buying yourself a little time. Multiple layers of protection is just buying yourself time, is what I kind of think of it as. The third line of defense is if they breach those barriers, let's say, and the child makes it to the pool, at just basic survival skills, if nothing else. I mean, we don't need to necessarily have a Michael Phelps swimmer, but we need them to understand that they know how to turn around and grab the wall or either float until help arrives. Basic survival skills is crucial in our state. And last but not least, if all else fails, CPR. Every caregiver in the home should know CPR because seconds really, really matter. And if a child is pulled out and somebody, a caregiver, bystander, starts CPR, the chances of survival or at least improve outcomes go up drastically. And so again, it's very simple. It's supervision, it's barriers, it's swim lessons, it's CPR. And if you know these things, it doesn't have to happen. It's preventable. So knowledge is power. Just keep pushing those things out and understand that all it takes is 2 inches of water for a drowning to occur.
A lot of people tend to rely on like the water wings, the floaties. Do we have any research on that? Yay or nay? What do we know about that?
Um, there's a lot of research, but it's also people are very strongly, I guess, opinionated on that. And so it's a little bit of a controversial topic. A lot of families are using these puddle jumpers because they're U.S. Coast Guard approved and everything else. And what we've talked to a lot of professionals in the community about with proper flotation devices is if you're in a community pool or backyard pool or more of a man-made situation, a flotation device of any sort should not be used. If the child doesn't know how to swim or has limited swimming ability, a parent should be holding, if not arm's reach, with that child. And so they really shouldn't be used. First and foremost, they teach the improper technique. They float you like this rather than like this, which is kicking to the wall, which again, it confuses the child as they learn to swim. It also provides a false sense of security for the parent or caregiver as well as the child. And so it kind of confuses them, whether they have them on or they don't have them on. The child doesn't understand that piece of it. And so there's a lot of mixed signals, and children shouldn't be using them if they're in and near the water. While if you're on the boat, then obviously you want to have a U.S. Coast Guard approved life jacket. And again, make sure that it fits properly and everything else, because those are things that you're on the boat, you should be having all children, even adults, in the life jackets that are U.S. Coast Guard approved. But if you're in any other setting, a parent should be within arm's reach if not holding that child if they're non-swimmers. So I don't think that you should use them. And again, I was a big supporter of floaties. I had arm floaties for both of my girls. I took videos of them floating in the deep end of the pool thinking, oh my gosh, they're swimming. And again, it's just, I didn't know any better. And so this is my job now, is to just teach you. You do know better. You don't need to use those. Children can learn as early as 6 months, and really just start early.
Yeah, and you guys need to remember that kids with autism have a hard time generalizing skills in, overall. Knowing something in one place and being able to transfer it to another one is something that a lot of people in our community struggle with. And so if you put floaties on one day and then you expect them to swim, you may
Confusing.
not get what you think you're going to get.
Right, right. And
So
I
it's
circumstances where the parents or the caregivers take the floaties off the child because the child doesn't want to go in the water. Moments later, that child's floating in the pool or floating in the body of water. So again, I think just introducing it is setting yourself up for failure. So I think that as long as you start them early and you repetition and just teaching them, it's definitely a better way to go about it.
So now going into teaching. So is there a certain type of instructor or certain certification that parents should look for when they're looking for a swimming instructor for their child?
Yes, you definitely want to ask those questions when you're going to look for a person to do lessons with. You have to definitely make sure that they're certified, that they have certifications in American Red Cross, YMCA, or another accredited organization. And if you want to feel more comfortable, then make sure that you look at them. They also have to be trained in CPR and first aid. And again, most public pools, they should. There's a Florida statute that requires them to be certified in these with this. And so American Red Cross, the YMCA, or other accredited aquatics programs have those. And again, each municipality provides their own and what they do. But as long as they're certified, and I would definitely make sure that I ask those questions, ask if they teach children or adults, ask if they teach children with any kind of special needs or disability, definitely find that out so that you have the best person working with your child, because you may have one and it may not work for your child. They might not just gel properly, or they might not be equipped to be able to deal with your child. So then you ask for another, but again, you have to be your child's best advocate and find what works best for you and your family. But
Yeah.
yes, it's Florida law that they have to be certified. So I would definitely make sure that you're going to a place that the person teaching your child is certified.
Yeah. What are some organizations within the state that might be helpful to a parent when it comes to learning more about water safety or CPR? I mean, how do they know how to connect with those type of organizations?
Well, in Broward specifically, we have Water Smart Broward, and I think that is the really great use of that. Otherwise, there's YMCA's that are all local. Your municipality pools. Water Smart Florida is also out there. Florida Swims is another organization that could kind of point you in the right direction. But I would just kind of contact the local YMCA's. I would talk to the local municipality pools. Water Smart Florida, again, will direct you to the closest task force or resources that are in your community. And all else fails, contact watersmartbroward.org, and it goes to me, and I will help you navigate what you need.
Are there any certain questions that you can think of that when a parent goes and checks out one of these schools, certain things that they should ask, or is it pretty much just some of the things that you already went over, like the CPR and the certification? Is there anything else that stands out that you think is beneficial for a family to ask a potential swim school when they go and they're checking them out?
I would ask their class size ratio. I would definitely ask that if there's a lifeguard on property. If they were trained in any other additional certifications that would allow them to be a better instructor, I would definitely ask. I would ask, I don't know, that's a tough question. I don't know. I think I would just ask the ratio. I think more so than anything is just making sure that it's one-on-one and where the child's going to get the best service for what you're doing. And in some cases, I would just kind of feel out if they deal with children with any kind of disability or ages, the language if they serve, and just figure out what you feel. Because again, if your child's going to be crying through the whole thing, in most cases, those parents may quit after the first lesson or second lesson. And what we really want to encourage everybody to do is really stick it out and follow through with it so that their child is safe around the water. And again, good swimmers drown as well. So just because they are swimming doesn't mean that their supervision shouldn't be there, or that your guard isn't let down in any capacity too. So.
Right. No, and our kids tend to be daredevil sometimes, which
Right.
further complicates the situation.
Right.
Well, Casey, thank you so much for coming on today and talking to us. We really appreciate all the information. And just so that you guys know, if you have a swim school, if you find a swim school that you think might, be a good one for your child, but yet maybe they're lacking some specific knowledge in autism, you can have them contact the Autism Society, because we do provide trainings to swim instructors out there, just with some helpful hints about how to incorporate visuals and social stories and video modeling. The stuff that we know just tends to work for our community in general. So we are there to help them. We want to be able to change the statistic that you guys just heard about. We really need to make a dent in this. It's been the same statistic for our community, for the autism community, for a really long time. And so the Autism Society of Florida is trying to make some changes there. And through efforts of great people like Cassie McGovern, who's just so dedicated to saving children's lives, we really feel like we're going to be in a better position by educating you. And something Casey didn't mention that I know that she does is she's out there talking to pediatricians and educating people that we really count on as
Yeah.
parents
And
and making sure they
um,
understand.
wanted to kind of just elaborate a little bit on that
Mhm.
pediatric of it.
Good.
Um, I don't think they're having a loud enough voice when it comes to water safety and that kind of component because their plate is so full with so many other things that they have to talk about. And that's the consensus regarding all of the doctors that I have been speaking to is there's so much to cover in a short amount of time. And so having these discussions, and if your doctors aren't talking to you about it, you talk to them about it so that they could see the conversation needs to be talked about more and more. And I think that that's what it is. It's just not enough people are talking about it. A lot of us go to the pediatricians for them to give us the guidance. And if they're not getting that piece of it, then we're not really valuing that information. And so I think that if they're not talking to you, you talk to them about it because they're not. They're just too busy. And I understand it.
Yeah. Well, we, as the autism community, we have that issue even with diagnosis, that
Right.
sometimes we have to go out and educate ourselves and go to our pediatrician and say, we think this, and kind of push them because it's the same thing. It's time and
Right.
having enough time with our kids to
Right.
really look at them and really talk to the parents about, something that frankly is devastating if you experience it.
Right.
um, so guys, go educate your pediatricians. Even if you have an older kid, just think about all the families that will come after you that will see that pediatrician. So speak to them, educate them. And again, thank you, Casey, for coming on.
So
Really
much.
appreciate it. And we're so appreciative for everything that you do for all children in the state of
Thank,
Florida and helping to save lives every day.
thank you very much for having me. I really appreciate it.
All right, you guys have a great day
Good
and
day.
look out for us next time. Thanks so much.